Welcome. You're listening to Latin Waves with your hosts, Sylvia and Sylvia Richardson. Latin Waves is more than just hot rhythms. This is a show about community, about creating a culture that is inclusive and based on fairness. Because everyone deserves dignity, respect, and has something to contribute. A new world is possible, and it all starts with us.
The courageous efforts of frontline workers in the health service, cleaners, cashiers in supermarkets in fighting this pandemic and making sure basic things continue to work. This is one thing. It's a glimpse of how society could be organized if instead of for profit, it will be organized democratically in order to defend the general interests of the people, their health care and their livelihoods.
That's the voice of Jorge Marti, Secretariat of Hands Off Venezuela. In this week's show, we speak to Jorge about the ongoing global pandemic, what should have happened sooner, and what as activists we could rally around now and keep our eye on. So stay tuned.
You are listening to Latin Waves and your host, Sylvia Richardson. I'm delighted to be joined by Jorge Marti. He's the Secretariat of Hands Off Venezuela. Welcome to our program, Jorge.
Yes, I'm glad to be with you again.
Now, the COVID-19 pandemic has now gone viral worldwide. Can we talk a little bit about first of all, how are people in your region, and how this new pandemic, which I think the economic collapse of capitalism, the constant cyclical storms of capitalism have exacerbated our ability to not only keep people healthy, but to have a society that can aspire to health.
Yes, obviously, this COVID-19 pandemic is first of all a health crisis. It has spread very fast throughout the world, and right now in Europe, most countries are in one form or another under quarantine. People are being told to stay at home, to go to work only in cases of essential work, and so on. And this has obviously penetrated the consciousness now of millions of people. I think the latest figure I've read is that about a third of the world's population is now in one form or another of a lockdown. But this virus has two characteristics which make it more deadly than other previous pandemics. One is that it seems to spread very fast. And it also seems to spread when people still have no symptoms for a few days before you develop any symptoms. So it's very difficult to control its spreading throughout the population. But the second one is that while for the big majority of people, it only provokes mild symptoms similar to a cold or a flu, for the minority, about 20% of all those infected will develop more serious symptoms, and a fraction of those will require intensive care hospitalization with ventilators, oxygen, and so on. And because the virus is spreading very fast and a lot of people require intensive care unit treatment at the same time. And this is what's putting the health care systems under a lot of strain. However, we must go beyond the purely health side of this, because this also has social and economic factors involved. For instance, the fact that for the last 10 or 12 years, there's been a relentless push towards cutting healthcare spending through austerity policies in most Western capitalist countries and throughout the world. It means that healthcare systems are now much less prepared to deal with an emergency like this. This is the first observation that we should make. In Italy, in Spain, in Britain, in many other countries, there are less healthcare professionals, there are less hospital beds, there are less intensive care unit beds in hospitals, and there's been a process of privatization, cutting down, reduction of the number of staff, and so on, which means that now more people will die just because of that reason. The second observation that we need to make is that many governments have taken very long in taking decisive action to prevent the spread of the virus and to prevent the spread of the contagion. And the reason for this is very clear. Trump said it the other day. We don't want to stop the economy. That is, the profits of a capitalist take precedence to what will be required from a health point of view to prevent the spread of the epidemic. What's required is a total lockdown. All non-essential sectors of the economy should be closed down, and people should be staying indoors for a period of time, be that 2 weeks or 3 weeks. But the capitalists are resisting this. For instance, in Italy, there's been a wave of strikes for the last 2 or 3 weeks where workers are saying, what are we doing in a car factory producing cars in the middle of this epidemic, where we're forced to go to work in cramped conditions. Then we're forced to work in unsafe conditions where social distancing is not observed. And we are risking infecting ourselves and spreading the virus to other people. And the only reason for that is because of the profit motive making. Capitalists will still want to make profits. And therefore they're putting the lives of workers at risk. So this is the second observation. The first one is about the impact of austerity policies on the healthcare systems. Second one is the contradiction between the general interests of fighting the pandemic and the interests of the private owners of capital who want to still keep production even in these conditions. And the third one, I will say, is the fact that even in these conditions, the basic requirements have not been met. For instance, the epidemic first affected China. So, and this was some weeks ago. So we know what happens, and we know which methods are necessary to be implemented, and we also know which supplies are needed, i.e. protective masks, protective equipment, and also respirators, ventilators, and oxygen masks and ICU beds. And governments around the world, in Spain, in Italy, in France, in Germany, in the UK, in the United States, in Canada, they have had a fair warning. They have had a few weeks to prepare for this. But in most cases, they have not. They have not built new hospitals, or they have not taken over empty buildings to create hospitals. They have not given even healthcare staff, frontline staff, the necessary personal protective equipment. And this is now a big scandal in all countries. And the only reason for this is because of money. The governments are not very keen to spend money. And only when it comes to when the crisis really hits them, then they start acting. And by that time, it's already too late. So there are many hundreds, possibly thousands of deaths from this virus, which will have been avoided in a system that will have been organized around different criteria, the criteria of saving people's lives, rather than the criteria of maintaining the profits of few capitalists. So yes, the pandemic has a health care aspect to it, but there's also a very strong social and economic implications which are making it worse.
Now, I want to talk a little bit about what happens during the storms of, whether it be a pandemic or simply when disasters happen. When disasters happen throughout Latin America, we've seen a more rapid privatization of social services. And, it's interesting that for years now, we've known that poverty kills people. We've known that poverty makes people more vulnerable to disease, more vulnerable to insecurity of all forms, right? So now that we have this pandemic, it seems out of nowhere we're seeing private hospitals, which is adequate that they should rise and attend to this. But I'm concerned about what you point out is that for years we have been cutting to healthcare and universal systems of healthcare, and now is there a threat that this will lead to another wave of privatization that will deepen the neoliberalist agenda?
Yes, when in reality it should be precisely the opposite. I mean, I would say that in these conditions of emergency, government should be requisitioning private healthcare facilities to use them for this. In Britain, for instance, there are private healthcare facilities, and the government is now renting them out in order to fight the pandemic. So they continue to give millions of pounds to the private sector, so that private sector bosses can profiteer out of this healthcare emergency. And as you say, now in the last maybe week or so, the pandemic has reached what we usually describe as third world countries. And in these third world countries, to start with, the healthcare system is in a much worse state. These are countries that are highly indebted to the international financial institutions, which extract from them extortionate rates, extortionate amounts of money in debt, which was contracted in order to purchase products from the advanced capitalist countries in the first place. And these countries have no money left to spend in healthcare, in education, because of these policies and because of imperialist looting. And in these countries, the pandemic will be even worse. We haven't seen the last of this. We haven't seen the worst of this pandemic yet, I don't think. And of course, now all the governments are spending a lot of money. They're spending money in bailing out companies, in some cases in supporting workers to a certain extent who had to go home or been laid off. But in reality, as it always happens, it is a case of socializing losses and privatizing profits. Most of these companies, the airline companies, the car industry and others, they made huge amounts of money in the last few years out of the workers' sweat and toil. And now, when they're in difficulties, they put their hand out so that the state bails them out with money which belongs to all of us, because all this money that's being used, $2 trillion in the United States, massive amounts of money everywhere, this money will be paid later on by the working class and by the poor through taxation, through austerity policies, or through inflation, or a combination of the three. And this is complete madness. I mean, the capitalist system is making this pandemic much worse, and the lack of democratic planning of the economy, the lack of foresight, the fact that private profits are put before people's lives is making the whole situation much worse.
Now, I am very aware that during this time, we really know who the essential workers are in society, who the essential people are. You know, when we look around, the cleaners at the university, the cleaners at the hospital, the people who serve food, the people who tend to the stores to ensure that you have, ambulances and the nurses, the doctors, all of these people are essential to our well-being. And although doctors are, fairly well remunerated in most places, I would argue that some of the most vulnerable people during this pandemic are the ones that are least compensated for their work. And I bet they're not getting extra pay for their danger exposure. So can we talk a little bit about this conscientization that needs to occur among all workers, because many of us as workers don't even see those people, don't even see how essential they are to our well-being and how inequitable are the ways that they're treated and compensated.
Yes, you are right. And I think that this is changing now because, like, for instance, the other day, the British government issued a list of what they consider key workers, so that some of them, if they need, can still take their kids to school, so that they don't have to stay home to look after them. And obviously the list of key workers doesn't include stockbrokers, state agents, capitalists, bankers, and no, it doesn't. Obviously the list of key workers is people who work in the NHS, people who work in the food distribution and retail, and these kind of people, as you say, hospital porters, cleaners, cashiers in supermarkets, people who stack shelves in the supermarkets, people who work in poultry processing plants, and so on. These are the people who make capitalism work and who have the most important jobs in order to maintain life and to maintain health. And as you say, many of them are extremely badly paid. Most cleaners, for instance, are in outsourced contracts, barely earning the living wage. Many of them here in London don't have the right to holiday. They don't have the right to sick pay, for instance. And they're not even protected in the middle of this pandemic, for instance. Not even to talk about cleaners, but hospital staff, i.e., doctors, nurses, porters, and all sorts of jobs in hospitals. They don't even have the personal protective equipment that they need. They don't have masks. They don't have overalls. They don't have hydro sanitizing gels. They have nothing. And in hospitals in Spain, they've been making protective equipment out of things that they found, rubbish bags, bin liners, stuff like that. It's a complete scandal, but I think it's also making people realize who are the workers that are essential for the functioning of society and for the running of for the defense, for the protection of lives and the health of the people. For instance, in Italy, in Spain, now here in Britain is starting again. People are coming out at 6 p.m. or at 8 p.m. and they are making noise out of the windows and balconies. They're clapping and applauding essential workers. And this is obviously a very powerful movement, and it will be very difficult for governments after this is over to argue that they shouldn't be paid, that they shouldn't get a pay rise, that they shouldn't be properly paid and cared for and protected. And to this list, we could add the carers, the people who work in social care sector, who go to the home of vulnerable people, the elderly, the disabled, and so on, and they look after them. And they also continue to work in the middle of this pandemic, even though they've not been given any protective, personal protective equipment or anything like this. This is how capitalism works, really, and now many people are realizing, and there's a revulsion against it, I would say.
I think that it's important that we learn from our histories. When the epidemic of cholera happened in Haiti, we saw a massive privatization, not only of their health providing systems, but also of many institutions in the country. And, here in Canada, we're starting to see a lot of movement towards privatization from our universal healthcare program. And Ontario has been leading the charge trying to expand, private healthcare in the region, but also we see danger of privatization in BC, in Quebec. And I worry that when people are confined to isolation, when we don't have an opportunity to come together, to share ideas, to be in contact with each other, all of these things, get pushed, in the dark. And then we wake up once, gladly the pandemic has passed, but to find that we have a new kind of pandemic, one of rapid privatization, one of rapid cuts to our social networks and systems that we need to have a sustainable society. Because to me, sustainable means being able to live and coexist, and where everybody has a chance at life, not just those who can afford to buy it.
Yeah, this is true. What you say, they're going to take advantage of this again. First, to socialize losses, make us pay for the bailout of the rich and the wealthy and the big companies, and also to introduce measures like this for the privatization, for the encroachment of the private sector into the public health care, when in fact this whole situation proves the opposite, that the opposite is what is needed, a well-funded, properly resourced public healthcare system, free at the point of use, and universal for all. But I will also say that this situation of national emergency, because it is in many countries, it is, has also brought people together in a different way. For instance, here in Britain, there's been the emergence, the springing up of what is known as mutual aid groups. And these have been created everywhere, in every borough, in every ward, in every neighborhood, in every street. I think there's now about 2.5 million people who have volunteered to be part of these groups. They get coordinated through WhatsApp, Facebook, and other social media tools. And they basically have gone door to door to identify the most vulnerable people, people who are self-isolating or the elderly, people who can't go out. And they offered in a volunteer way to run errands for them, to go to do shopping or to go to the food bank to pick up some food, medicines, and so on, just to keep in touch one with another in these times of isolation and quarantine. And I think this is very powerful. It shows that human nature is instinctively social and cooperative. And these organizations or groups, networks, that have now emerged in the middle of this emergency with a eminently practical aim of helping people out, they will not go away. If after this pandemic the governments push privatization of healthcare, these people will stay together, or the majority of them will stay together and will fight and resist this. People are also learning very valuable experiences about their own strength, their own ability to organize, their own ability to create networks of mutual support, of mutual aid, regardless of the failings of the state and the government. And this is a very powerful lesson, which I think will remain after this is over.
Now, while we are distracted, and perhaps rightly so, with the alarming issue of pandemic, we lose sight of the struggles that other people are facing on top of having to deal with the pandemic. You know, the people in Bolivia have recently faced a coup. The people in Venezuela have been fighting off an ongoing attempt to overthrow their government. How are solidarity movements to stay alive, and what must be remembered during these times?
I think now it's a very good time to argue for the end of sanctions. It is quite clear, and it's obvious to everyone, even some politicians in the European Union who are not particularly friends of the revolutions in Latin America have been arguing for this. At a time of a health emergency of this size and scope, it's vindictive and it's cruel to maintain sanctions. And the United States is maintaining them, is insisting on maintaining sanctions on Iran, which is one of the countries worst affected by the pandemic, to maintain sanctions on Venezuela, which prevents Venezuela from importing the necessary equipment, funding their own hospitals, and so on. And I think that now it's a good time to agitate around this demand. Never mind all the rest, we were still fighting for everything. But now I think we should be concentrating perhaps some of our efforts on this one question, which can have a big impact. The idea of, even if it's just temporarily, lifting the sanctions, so these countries that are subject to sanctions regime can purchase and acquire the necessary medical supplies in order to fight the pandemic. Because otherwise, sanctions usually in normal times kill people as a result. But in this, we're now talking about imminent danger of killing thousands of people just because of these sanctions. And I think that this can have an impact agitating around this question right now. There are many other things, like, for instance, there's a few hundred Venezuelans in the United States who now want to return back to Venezuela, which has not been badly affected by the pandemic yet. The Venezuelan government has put at their disposal a number of flights, and they say they are ready to come and to the United States and repatriate these people. The United States is still insisting that Venezuelan aircraft cannot fly into the United States, even for this limited purpose. So we should be really agitating around these questions.
As we part, perhaps you can share with us what inspires you and what your hopes are as we not only weather this storm, but also grow stronger in our resolution for an equitable world.
I will say two things. The first one is I've already mentioned that this crisis has brought out the best in human nature. The natural instinct to help each other out, to organize in order to do so, the courageous efforts of frontline workers in the health service, cleaners, cashiers in supermarkets in fighting this pandemic and making sure basic things continue to work. This is one thing. It's a glimpse of how society could be organized if instead of for profit, it will be organized democratically in order to defend the general interests of the people, their health care and their livelihoods. Number two, I think that this health crisis, this pandemic, is bringing out the class struggle again. Is making it very clear for millions of people who never thought about politics before, the fact that the private profits of capitalists are in contradiction with the lives of the majority, that there's no reason why this should be happening at this level, that many lives could be saved if all resources of society were put to the disposal of this struggle. Yesterday, for instance, in the United States, on social media, there was a hashtag that was trending that said, I will not die for Wall Street, because some governor had suggested that people should be glad to die instead of paralyzing the economy. And they were also talking about the idea of a general strike, a national shutdown of the economy by the workers. So out of this crisis, many people will come to realize how wasteful and criminal the capitalist system is, that puts profits before lives. And this, combined with the economic recession, which has been aggravated and triggered by this healthcare emergency, will bring out a situation of one, class struggle, but also a deep change in the consciousness of millions of people in relation to their understanding of what capitalism is, how capitalism is a barbaric system, and how we need a different system. A process that had already started, but will be greatly accelerated by this epidemic, in my opinion.
Where can people reach?
Yeah, definitely. People can contact the Hands Off Venezuela campaign on social media, HOV campaign on Twitter, and handsofvenezuela.org on the website. And I'm also on the editorial board of Marxist.com, in defense of Marxism, Marxist website providing analysis and news about the struggle against capitalism. And we are running a special coverage of the whole of the COVID-19 pandemic. We carry regular news about the worker struggles in Italy, in Spain, and in other countries, and also explanation of what this means from the point of view of the class struggle, what we've been discussing in the last few minutes. So people can visit that at Marxist.com, in defense of Marxism.
Thank you again. Take care.
All the best.
We've come to the end of our show, Latin Waves. Latin Waves is an internationally syndicated weekly program made available through campus and community stations and available out to the world at www.latinwavesmedia.com. Visit Latin Waves Media to hear previous shows, to access resources, or support our efforts towards social change via community project engagement. Thank you, and bye for now.